If you've just been diagnosed with prostate cancer, one of the first numbers you'll hear is your Gleason score. It can sound confusing, so let's break down exactly what it means. When a pathologist looks at your biopsy under a microscope, they identify the two most common patterns of cancer cells present. Each pattern is graded from 3 to 5, based on how abnormal the cells look compared to healthy tissue. These two patterns are added together to create your Gleason score. The first number is your primary pattern, the most common pattern found in the biopsy. The second number is your secondary pattern, the second most common pattern found. In this example, a primary pattern of 3 plus a secondary pattern of 4 equals a Gleason score of 7. You might wonder why scores don't start lower than 6. That's because pathology guidelines changed years ago. Patterns that used to be labeled as 1 and 2 were found to be unreliable and are no longer used in modern grading. So today, Gleason 6 represents the lowest grade of prostate cancer identified on a prostate biopsy. Because patients often hear the score described as a number out of 10, many who learn their score is a 6 assume it sits above the midpoint, and therefore their cancer is more aggressive than it actually is. In reality, Gleason 6 prostate cancer is so indolent and slow-growing that it rarely, if ever, requires treatment. To make scores easier to understand, doctors also use a simplified, more modern system called grade groups, ranging from 1 to 5. Grade Group 1 corresponds to Gleason 6, the lowest risk category. Grade Group 2 corresponds to Gleason 7, known as Favorable Intermediate Risk category. Grade Group 3 corresponds to Gleason 4 plus 3 equal to 7, known as Unfavorable Intermediate Risk category. Grade Group 4 corresponds to Gleason 4 plus 4 equaling 8, known as the High Risk category. And Grade Group 5 corresponds to Gleason 9 and 10, known as the Very High Risk category. Your Gleason score and grade group are just one part of the full picture. Alongside your PSA level, imaging, and overall health, they help guide decisions about active surveillance, treatment, or further testing. If you've received your results and want help understanding what they mean for you specifically, I offer one-on-one consultations to walk through your diagnosis in plain language. Visit www.myprostatepath.com to schedule a session.